Hi, I'm Dr. Jaban, and there was a study done on Epstein-Barr in 2006 that I just had to talk about. So this study was done on patients with enlarged spleen, and the study was done to see if they could get, using nutrients, the reduction of the spleen, and they were successful. There were 50 patients. In that study, it showed that the 50 patients' spleens reduced in size doing nutrient supplementation. Now I'm going to get into a little bit of what they were trying to supplement for and what those supplements were as we go forward. So here we go. So what they were looking for was there's four main attributes that they were looking at. Xanthine oxide they found to be 200 times higher in patients with Epstein-Barr, and this is something that they were going to try and reduce using nutrients, because when that's elevated, it creates a negative response in the body because it is inflammatory. NF-kappa beta is another protein complex that's going to be in the body. This protein complex does also trigger inflammation, and that inflammation can lead to breakdown of tissues in the body. So they wanted to reduce NF-kappa beta also. Endothelial nitric oxide, which is a gas that's released in the body. This gas will reduce lymphocyte function, reducing the immune system regulation, allowing for infections to continue to proliferate. Infections just like Epstein-Barr. And then there's the inflammatory domino effect that happens. So the body, as all of these other things are going on, as all of this inflammation is building up, the domino effect continues, and then you get increased prostaglandin, you get increased other microparticles in the biochemistry of the body going up, and that decreases your body's lymphocyte reactions, decreasing the immune system, leading to a further breakdown of the immune regulation of the body, allowing, guess what, Epstein-Barr to continue to take over, causing that spleen to continue to be inflamed. So what they do, they said, well, if we can get some nutrients in, just like over here, vitamin C and E, NAC, selenium, and zinc, those are the ones they chose to try and reduce NF-kappa beta. They also used NAC and methionine to reduce the nitric oxide. So those were the main pieces of what they used. And they theorized this could reduce spleen size by reducing the function of the breakdown of the body due to Epstein-Barr. And they were a success. So this was groundbreaking, finding the ability to reduce an organ swelling using nutrients caused by Epstein-Barr. Amazing, right? They have evidence to show that this is the way that you can help treat people naturally, because antivirals didn't work. Antivirals don't work on chronic Epstein-Barr. And that's one of the key things that we're finding is medications can do a good job in certain places, but we also need to use the body's natural function, using these nutrients to support natural function to heal the body. Now, some other ones that you could throw in there, you could throw ginger and boswellia, turmeric. You could also pull in resveratrol. A lot of those are going to help with immune system and anti-inflammatory reactions. You could use monolaurin and golden thread along with elderberry just to help bring up the body's natural immunity. But these are what were chose for this specific study. So there's just a little bit of information there showing natural medicine, natural nutrients can help to heal the body. So make sure you're getting these kinds of things in when you're dealing with Epstein-Barr, when you're dealing with viruses, because they can help you to get well even when the medications like the antivirals are failing.